My name is Dr. Davis Capaccioli. I own Peak Eyecare in Durango, Colorado. I've been with Maximize since I opened as a cold start 3 years ago. As a cold start, I didn't have any data transfer. The team walked me through how to make sure I had my patient scheduling set up. If I had any issues on how to make sure that the optical was connected to different labs, I could send directly through Maximize to the lab. If I had a question, I could either email or call them, and they picked up very quickly. So I appreciated the support, and that's been the same since even after the onboarding process. I could get answers when I needed answers. When we have a new hire, we have them go through the initial training, getting started with Maximize feature. It allows them to just get comfortable with the EHR system looks and functions, and they can ask questions directly to the Maximize team as well too. But that's our day one for every new hire, is going through the training that Maximize provides. I like trying to make things as simple as possible for my patients, so being able to combine forms all into one, whether it's the vision versus medical form, talking about insurances, or consent forms. I like to simplify it and make it simple into one form. Also, Maximize allows us to send the form to the patient ahead of time and sign the form, which saves us a lot of time. Patient intake form that they can do at home actually uploads to the chart in the actual spot. So say they have a family history of diabetes, that gets marked in that patient form as well too. I use the patient engagement premium, or allows the patients to be able to schedule directly to my schedule at home. They don't have to put in a schedule request. They have access to my schedule. So if they're scheduling at 10 p.m. at night, I don't want them to have a schedule request for the next morning. I want them to know, hey, I'm actually going to be seen the next morning. We've done a few patients where they've had gaps in the morning the next day and they've been filled that night. And I worry about if they do a request, we're not going to answer it until it's too late for them to get there. The recall system's super nice. They get text messages, they get emails, I can customize those. If you're debating between a few different EHR systems, I think Maximize has the cleanest looking interface. I really like the support that they give me as well too. If I have an issue, I can call them directly. So overall, I would highly recommend Maximize if you're looking for an EHR system that's a new, up-to-date, and works well.